Despite warm weather outside, lately some children have been coming down with a typically cold weather virus. The health officials say some parents are mistaking for COVID-19. News Watch 12's Megan Mamlock caught up with UW health officials today and joins us now live in studio with details. Megan.
Thanks, Justin. The CDC put out a health advisory on June 10th about the increase of a virus called RSV in the southern part of the United States, encouraging more people who are sick but test negative for COVID-19 to see if they have this instead.
So RSV is an abbreviation for respiratory syncytial virus, and it's a virus. COVID is a virus. It's not the same as COVID, but it's a very common virus that causes inflammation in the airways. And for the most part, it's a disease that affects most severely very young kids, so kids under 1 year old.
It's unusual to have RSV in the summer, but with the masks keeping many of us virus-free this past winter and not having to wear masks right now, doctors say they are seeing a resurgence.
Younger kids under a year old, they'll usually start having some cough. You'll start noticing some secretions, and breathing, how hard they're working to breathe, can sometimes increase. And that's the thing we want parents to look at the most.
If your child looks like they are really struggling to breathe, it's time to take them to the doctor for care, because health officials say once their muscles fatigue, it can turn dangerous. And because COVID-19 and RSV both affect the lungs, the patients will most likely be tested for both viruses to rule them out.
It's basically an NP swab, just like we do for COVID, except for instead of looking for the COVID virus, it usually looks for RSV, and then it's often a combination test, looks for influenza A and influenza B, just because during normal times, these things are all out there at the same time.
But there are easy ways to avoid catching RSV.
Prevention of RSV is things that people are going to recognize immediately. It's, good hand washing. Certainly don't send sick kids to school where they could infect other kids with this virus, especially younger kids, say in daycare settings and things like that.
And just a reminder that older kids and adults will have milder symptoms and resolve on their own. Doctors are still unsure why this is occurring during the summer when it is typically fall through spring. Justin?